This annoying nail issue can begin small, but grow into a painful and chronic condition if left untreated. The problem is, however, they can be hard to treat and manage, and often take professional intercession. Here's what to do if you have an ingrown problem or suspect you are developing one. Make sure to subscribe for more great content like this. What is an ingrown, and what are the causes? Simply put, these are nails that grow into the skin rather than sitting atop the nail bed. The severity could range from a mild annoyance to painful throbbing and infection. They have a wide range aesthetically, too, and ingrown could appear as small as a mini indentation of the nail on the side to full-blown curving of the nail. They can get so severe that they cause infection, especially if you are the kind to mess with and pick at the ingrown. Ingrown toenails can be caused by tight shoes, improper nail trimming, and genetics. Tight shoes could mean pointy-toed heels to running shoes, so always be certain that your shoes fit correctly. Incorrect nail trimming usually means that you are cutting too short, which allows for more opportunity for the nail to grow into the skin, as well as cutting it at an angle around it. You may have the desire to give your nails playful shape, but keep your toes basic and straight across. The second reason is people who may not necessarily cut the nails too short but tend to round off the edges because the sides may feel more brittle or yellow. And finally, due to the fact that the annoying condition can be an inherited one, it may not be anything you've done wrong. Some people just get them more regularly. Often it is a combination of all three. In any case, it's best to start remedying the situation right when you suspect you have one or are developing one. As is the case with most things, prevention is easier than treatment. 1. Find better footwear. As one of the main problems with ingrowns is footwear, you should take a look into your shoes and make certain they are not too tight. Yes, this means the obvious pointy-toed high heels or dress shoes, but you need to be aware of your workout sneakers and running shoes as well. Always make certain these shoes are correctly fitted, as you are moving around more and putting harder pressure on the feet during workouts, which may result in ingrowns. Another thing to consider, if one foot seems to get the ingrowns with more regularity, it could be that foot is the larger of the two. It's very common to have slightly different size feet, but as we purchase shoes in a singular size that could leave one foot slightly more compressed than the other foot. It's perhaps an annoying fix, but try getting your shoes in two different sizes and purchasing from stores that allow size variations. Finally, you can get protective inserts or toe separators to help. 2. Cut the nails straight across. The best shape for healthy toenails is straight across, no curves, no angles, no ovals. If you get your nails done professionally, be certain to inform your manicurist of your desired shape beforehand. If you do it at home, be certain to invest in a nail clipper that has a straight edge, as a lot tend to be curved. The straight edge will make it easier to obtain your shape yourself. Always be sure to keep the nails on the longer side. If you cut them too short, you create more possibility for the nail to grow into soft skin. 3. File a divot in the center of the nail. If you've kept bad toenail habits for too long, you can try to coax your nails back to health with this toenail trick. Right in the middle of the nail, just file down a little bit. Take your nail file at a 30-degree angle and work down no more than a centimeter. Regularly flip the sides of the file so you get an even divot. This tricks your nail into growing toward the middle rather than out into the skin. Then, when your nails grow out enough, you can trim them straight across again. This way you're not always walking around with a mini triangle in your nail. 4. Soak in an Epsom salt foot bath. Let's say you're too late on prevention. Then what's next? When an ingrown nail occurs, you can't really stop it from growing in per se, but you can sometimes prevent infection by soaking the toe or toes in Epsom salts mixed with lukewarm water. The foot bath will help relieve some of the pain associated with severe ingrowns. 5. Use apple cider vinegar. Apple cider vinegar is an at-home multitasker that makes for a soothing antibacterial treatment to help stave off infection. Brew an apple cider vinegar foot bath, and let your toes soak. As a bonus, the foot soak could help with other common foot conditions like athlete's foot or just general odor. 6. Use an antibacterial ointment. Despite your best efforts, ingrowns can easily become irritated and inflamed, so be certain to tend to it with an antibacterial ointment to kill the infection-causing bacteria. Do this twice a day. If you are one to stick to natural formulas only, don't worry, there are plenty of natural antibacterial creams available. Coroxin is a popular organic and derm-recommended choice. 7. Do not attempt to remove at home, it makes it worse. We understand how tempting it can be to pick and prod at these sorts of problems. It's so tempting to whip out tweezers or clippers and get to work fast. If you get one piece of advice from this video, don't do it. One should never try to perform bathroom surgery by attempting to remove the ingrown portion of the nail. This can lead to infection and even more serious complications if the person has underlying medical issues, such as diabetes or poor circulation. 8. Visit a podiatrist. It's important to consult a podiatrist as soon as possible if an ingrown toenail is painful or becomes infected. Signs of infection include pain, redness, swelling, and pus coming from the corner of the nail. Ingrown toenails can be easily treated by a podiatrist using a minor in-office procedure. The takeaway: when it comes to ingrown toenails, prevention is the best medicine. Always practice proper nail hygiene and look at your footwear, especially workout sneaks. If an ingrown does become a problem, it happens. Make sure it doesn't get infected, and visit a podiatrist.